Today we're going to be performing an electrocardiogram on Timmy. When doing an electrocardiogram, there are 12 leads total, but only 10 leads are used, as you can see. Performing an ECG, and the ECG records the electrical heart activity. That's what we're going to be looking at. That's what this test is going to show. Do we have your permission to perform this electrocardiogram? Okay, cool, thanks. Before you put your chest leads on, we already have ours on, but before you put them on, you have to make sure that you properly clean the area. And when you do that, you use an alcohol prep pad for each one of the areas, and you want to rub them hard enough to where the skin starts to turn red. So that way it's a good indicator of where you're actually supposed to put the electrode pads, and that way the area is actually sufficiently clean. And this is the electrocardiograph machine. This is what is going to be hooked up, and we're going to get the readings off of this, and we're going to get our printout right down here. And today we're going to be printing out a 10 lead ECG.
Okay, so we already have all of the leads on. So first is V1, which is in the fourth intercostal space, right margin of the sternum. V2, fourth intercostal space, left margin of the sternum. V3, linear midpoint between V2 and V4. V4, fifth intercostal space at mid-clavicular line. V5, horizontally adjacent to V4 at anterior axillary line. V6 is horizontally adjacent to V5 at mid-axillary line. So these are going to be used to view the electrical activity in the transverse plane, and V1 and V2 show the largest deflection of the QRS complex because they are closest to the heart. So also there are limb leads. Each one has an assigned angle. They go clockwise or counterclockwise and describe the position on the frontal plane. So there'll be right arm, left arm, right leg, and left leg. And those are abbreviated as RA, RL, LA, and LL. RL is the ground electrode. And so it's called AVR, AVL, and AVF. And AVR stands for augmented vector right, which is on the right shoulder, augmented vector left, which is on the left shoulder, and then AVF stands for foot, but it's at the umbilicus area.
As we said before, the right leg is the ground electrode, and these two pictures represent the Einthoven's triangle. This picture up here represents the standard limb leads, and it just shows the different type of planes that is going to be looked at whenever the ECG is going to be, when you get your ECG. The augmented limb leads, which is the AVR, the AVL, and the AVF, they show the different planes that's going to be looked at. And the inferior leads are leads 2 and leads 3, and the AVF leads, because they're all looking down more towards the foot. So that's why they're the inferior leads. And the lateral leads are the AVR, the AVL, and the lead 1. And the reason they're called the lateral leads is because they're looking out more towards the side, so more of a view from your side compared to an up or down view. Okay, this is a copy of Timmy's electrocardiogram results. And
this right here is the P wave. The little spike is the QRS complex. And then that right there is the T wave.
Mm-hmm.
And the P wave is going to show atrial depolarization, and atrial contraction is here.
Yeah.
Is caused here.
Mm-hmm.
Yep. The QRS complex shows ventricular depolarization, and atrial repolarization is hidden in here. And then T wave shows ventricular repolarization, and then ventricular contraction is caused here.
Mm-hmm.
Okay, on the sheet it's showing each lead being recorded for 2.5 seconds. So here's 1, 2, 3,
And then the AVR.
AVR, AVL, AVF, V1, V2, V3, V4, V5, V6.
And then also, when you're looking at electrocardiogram, you can also tell the heart rate. So you want to find where your QRS complex is as close to a single line on the graph as possible, and then you just count the number of squares until you find another line of the QRS complex that's just enough is equal, and then you count the squares. So it's 1, 2, 3, 4, and you divide that by 300. So Timmy's heart rate is about 75 using that method.
Normal sinus rhythm is your normal heart rate, and your average heart rate at rest is about 60 beats per minute. And tachycardia is a faster than normal heart rate, which is more than 100 beats per minute. And bradycardia is a slower than normal heart rate, which is less than 60 beats per minute.